My name is Bethan. It's I, the healthcare professional from the DSA.
Hello, my name is Abigail Harris and I'm an Information Officer at the Down Syndrome Association, or DSA. We have been supporting people who have Down syndrome, their families and the professionals who work with them for more than 50 years. The DSA regularly works with the Department for Health and Social Care, the NHS and NICE, to name a few, to improve service provision for people who have learning disabilities.
The DSA includes the voices of people who have Down syndrome in all their activities. The group is called Our Voice. Our Voice members will tell you their advice throughout this video.
Research has shown that in general, people who have a learning disability have a lower life expectancy than average and do not receive the same quality of care as those who do not have a learning disability. You can help change this. To support you as a health or social care professional, we have put together this video to signpost some of our resources, made in partnership with the Down Syndrome Medical Interest Group of the UK and Ireland. These are a few topics of interest rather than a comprehensive list, so please do also look at the links which come with this video or contact the DSA for these.
Reasonable adjustment.
The NHS has a legal duty to make reasonable adjustments to its services to ensure that people who have disabilities face as few barriers as possible to getting good healthcare. We know from calls to our helpline that some children and adults who have Down syndrome will find it difficult to tolerate certain procedures, such as blood tests, health screenings, and more.
Make sure the person is comfortable in the medical situation. If they are uncomfortable, they could have a family member or friend with them. Everyone can help each other.
The reasonable adjustments you can make really can make a positive difference to the experience that someone has, and these are just a few examples. Preparation. Can you make a visual guide of what is going to happen on the day, whether this is on paper or as a video? Can the person visit the setting before the day of the appointment? Can they meet the practitioner? Can they look at the equipment that's going to be used? And can you provide information in an accessible way, for example, in Easy Read? If someone is struggling to tolerate a procedure, is there a possibility of doing it in a different place? For example, we know of people who had their COVID-19 vaccines while they were sitting in the car. Can a longer appointment than normal be offered to make sure that the person has extra time to understand the procedure? Can you combine any procedures? For example, can you take blood tests if someone requires a general anaesthetic? Have you reached out to see if there are any other staff who could be involved? For example, a learning disability nurse or a play therapist for children. Check with your local community learning disability team. Health passports. These are valuable tools which contain key information about the patient, such as the way they communicate, their needs, allergies, and likely behaviours. Health passports vary across the UK, so check what's being offered locally. It's important to note that reasonable adjustments are individual to each patient, so something that might work for one person, such as more time to consider the procedure ahead, might make it worse for another patient. So make sure you take the time to work with that person, their supporters and their families, rather than assuming that everyone who has a learning disability will benefit from a certain adjustment.
Now that I live on my own, I'm more independent. I'm good at making my own appointments and I sort out my own medication myself.
Communication.
Have a conversation with me. Get to know me a bit more and be sociable.
Please be happy. Sometimes people are nervous if it is their first visit.
Be kind. I like people listening to me. Please speak clearly.
Talk with the person who has Down syndrome.
so they can understand what is going on. I had a situation in hospital where I didn't know what was going on, and I wish they had told me.
Many people who have learning disabilities will benefit from visual supports to assist understanding. If you need to explain a procedure, for example, it may not be enough to verbally describe what's going to happen. Pictures are good, but photos are best. If you can, include photos of the staff members who will be involved and any equipment or rooms which are to be used.
Mental health is important, and issues with it are increasing. Please be sensitive in case someone is nervous talking about it.
After my appointment, please make sure I'm okay.
Annual health check, learning disability.
Annual health checks are an essential part of ensuring that people who have learning disabilities access equitable healthcare. Anyone aged 14 and over can have one if their GP practice offers them. The checks help detect unmet and unrecognised health needs. The Royal College of GPs recommends that annual health checks consist of half an hour with the GP and half an hour with a practice nurse, with routine blood tests taking place at least 1 week before the check. On our helpline, we have heard of annual health checks consisting of height, weight, blood pressure measurement, and nothing else. A full annual health check consists of much more than this, and our full checklist can be found on our website. Of course, annual health checks are just one part of a person's healthcare and do not mean that further checks are not necessary. For example, just because ears have been looked at during an AHC, it doesn't mean that there's not an underlying hearing issue that requires a proper audiology assessment.
Diagnostic, overshadowing.
You don't want to misdiagnose or facilitate diagnostic overshadowing.
Be aware of misattributing symptoms from ill health to someone's learning disability. Common examples include changes in behaviour and communication. A full clinical assessment is needed whenever anyone presents with new or unusual symptoms for that person, including a detailed history and full examination. Unfortunately, we commonly hear on our helpline that significant weight gain and weight loss are attributed to someone having Down syndrome. As with all people, these can be a sign of serious illness and should always be checked out by a health professional.
Weight and exercise.
We get lots of questions about this, and managing weight and exercise is the same for people who have learning disabilities as for the whole population. We recommend using the NHS guidelines. People who have Down syndrome tend to be adept at sticking to a routine. Utilise this skill with visual timetables and visual aids. For example, a list of foods which make a healthy snack, or portion sizes of different foods, or a timetable with what time meals are. Find scheduled classes, activities, or friends to exercise with, and suggest times during the week when the person might like to do these. Set up a visual timetable with these on, and encourage the person to set up a reward system for sticking to the timetable. For example, how about a trip to the cinema at the weekend if you've been to all of your exercise activities during the week? With the consent of the patient, can you liaise with family members or social care staff to implement some of these ideas?
Down syndrome medical interest group.
The DSMIG of the UK and Ireland is a network of about 160 healthcare professionals with a specific interest in Down syndrome. The group are happy to receive inquiries from healthcare professionals on clinical issues relating to the condition. Membership is open to any healthcare professional who can demonstrate a specific interest in Down syndrome. Visit dsmig.org.uk for more information.
DSMIG surveillance guidelines.
The DSMIG surveillance guidelines have been developed to set out a minimum safe standard of basic medical surveillance, which the group considers essential to all people who have Down syndrome in the UK and Ireland.
Care pathways.
Find out if there is a specific care pathway in your trust for patients who have Down syndrome. If there isn't, can you consider setting one up?
Thank you for watching us.
Thank you for watching our short video. It was about supporting the health care of people who have learning disabilities. Please contact the Down Syndrome Association or the Down Syndrome Medical Interest Group for more information.